Namaste. Today we are in conversation with Dr. Rudrappa, a senior naturopath with more than 4 decades of clinical experience. His contribution to the STM Institute of Yoga and Nature Cure and also to the Arogyadhama clinics in Bangalore are phenomenal.
Today we have Dr. Y. Rudrappa, a very senior most practitioner in naturopathy from Karnataka. He has had his education in naturopathy from Hyderabad Gandhi Naturopathic College, and since then, not even a day he is away from nature cure field. Whether it is treating patients or training young budding naturopaths into naturopathy clinical practice, or teaching them the nuances and the fundamentals of naturopathy, he is there all the time, available to everyone. Thank you so much, sir, today for accepting our invitation and to come here to share your knowledge and the wisdom that you gained during these 45 years of your career. And we would like to tell people that he not only worked as a medical officer, professor, HOD, and principal, and also CMO of Ujre College, and all the students who passed out from SDM College, a very prestigious naturopathy college from Karnataka. And he has been a mentor with regard to naturopathy principles. And he is also a recipient of Patanjali Gold Medal given by Karnataka government and Karnataka Rajyotsava Award, the Best Teacher Award from Rajiv Gandhi University of Health Sciences, and many more awards. And his expertise in reaching out to people through TV talks and radio talks, and he has written many books and many articles. So here we have Dr. Rudrappa. Sir, now it is over to you. We would like to know from you how at all you came to nature cure, the field of nature cure, what attracted you?
Look, madam, in the beginning, I was not at all knowing nature cure at all. I don't know. I was a very poor person and working in a one sugar factory. And that factory owner called Mr. Shivamurthy Swami has seen the Nature Cure Hospital at Jayanagar, Bangalore. He has got interested. He has got interested that I have to do something for naturopathy and yoga. Those days, naturopathy mainly. And he came to me and asking, "Are you interested to be a doctor?" Then I was surprising. I was not at all knowing a field of this naturopathy or medical field. And why he is asking? And he said, no, 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 no. There is a simple system which can cure so many diseases with very simple modalities. And mud therapy, sun therapy, and hydrotherapy. Like that, I was there for 3 days and got very nice result in that hospital that is called Naturopathy Hospital at Bangalore. Then I was astonished. Then let me see that hospital. And he took me to Bangalore and shown that hospital. I too, as in, got it being a village person, maybe something else it is there other than being a clerk. And I was interested to, yeah, if you pay me something, I will go ahead because I don't have money to go learning for the colleges. Yes, he said, yes, I will pay you that much money, that which he was paying 120 rupees to me. Yes, I will provide 120 rupees to you if you go to the college. That college is the only one college that too in Hyderabad.
Yes.
Oh, I should go to Hyderabad. I did not go even out of my villages. How to go? Then he said, "Yes, I'll take you up and I'll introduce that college and I'll give an apartment and I'll give a seat to you." Yes, he took me and then I got interested and went into the college. Naturally, Dr. Garu and Dr. Ma was there, and they were convincing me about niche. This is how I entered into the College of Naturopathy by our Sri the Sivamurti Swamiji.
Yeah. Very good, sir. It is very nice to know that you came to nature cure by chance
By
due
chance,
to
yes.
us. But then that is again, if you see, it is not by chance. Also, the worth of the system came through Sri Shivamurti Garu to you. I think that is how the system takes roots, and then we have a person like you committed to the field. Yeah. And having come to understand how you have entered the field, now you tell us how your education was at Hyderabad.
See, my mentor was Dr. Enkutrao Garu and Dr. Vijay Lakshmi Garu. Right. They are the two people, pillars to my life, actually. And when I entered to the hospital and college, of course, college and then hospital, mm, hospital, I was wondering. I went to many hospitals those days, and there were all the departments and smell like the medicines and this and that. My hospital here, where I went inside, it is like a diet and treatment like massage, steam bath, and all very simple modalities. Having those days 100 patients, hundreds of patients in the hospital. I was astonished and surprised. I was in the notion that allopathy only is the hospital, or injection is the only hospital, tablet giving is the only hospital. This one is new modality. I surprised to know. Of course, I was not at all knowing the languages. I was very poor in English and poor in Hindi, and even I don't know. I was not knowing Telugu also. I was very one way I am dragging towards the system or towards the studies. Other way I am not understanding the languages. Wherein in Hyderabad, no Kannada people was there. In those days, and I was not capturing all the knowledge of naturopathy because of my lack of languages. Rather, I came with very pure Kannada medium school, village school, and went inside the college, and everybody started speaking in English. I was not knowing it. Gone against to my will and told to our Srimurti Swamiji, no, language is the bar here. I am not understanding anything. I want to run away from here. I want to come back to the sugar factory only. I don't want to study here. And immediately run away with so much eagerness. Sri Swamiji has come to me. No, language will come automatically. Don't worry. All the your friends are not knowing much about the languages. Everybody is like that only. You study. And made my principal, Dr. Vijay Lakshmi Garu, said me something. Vijay Lakshmi Garu was something, she was knowing Kannada. She said me some words in Kannada and I was interested. ಆಗಲ್ಲಪ್ಪ ಚೆನ್ನಾಗಿ ಓದು, nothing will happen, you study well, language don't worry about it, automatically it will come. Then I made my, of course, then about the inside the hospital, the twice a prayer and all, I felt it, so being little inclination or inclination towards my religion and all these things, it is a good enough to study well. And it is just like a modality like ashram way of living. I was in ashram one day, one year. I liked it. And morning, evening prayer and diet, sattvic food and all these things. Patients were, I was seeing all the patients. Even in the first year, I was interested in the go to the ward, speaking to the patients. Dr. Venkataru was telling, go to the hospital, don't disturb the patients. Like that, he was telling. Still, then I was to go and speak to them. what was your problem and how you got it? No, 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 very simple. I am all right. So and so disease, skin disease, gastritis. I am very all right within 3 days of time. Like that, I got interested by seeing a look at the hospital patients, and I got more interested and study well, and I confirm my mind. No, I don't want to run from here. I have to be here. Some or the other way, I have to be a doctor of naturopathy. Like that, I confine myself, consider my mind that to study well, study, go through the nature cure, and be a doctor of naturopathy.
So you
Okay.
studied the 4 years ND, right?
Yes, 4 years and yes, yes, yes.
ND. Mm. And
ND.
so from first year onwards, you started going to hospital and then gaining knowledge in clinicals.
That's what these days, there is intensive program only after 4.5 years, 1 year intensive program, right?
Yeah.
Our internship starts from first year onwards, though no other further internship program at all. So 4 years morning duties are always all the students, first year, second year, third year, and fourth year, all asked to be in the hospital. They have to work in the hospital according to their own subjects. Whether if it is a first and second year philosophy of nature cure, along with the diagnostic methods, the lecturer used to come to the wards and speak about the disease and explain about the pathology, anatomy, physiology, and all these things. They used to do it. And Dr. Garu was to come and speaking to philosophy of nature, how this patient has come and what is the philosophy behind it. So from the beginning till end, our internship was there. That is the internship. We did it. That was we thought of in mind. No internship. This is a job or this is a work. This is the studies from the beginning till fourth year. That is 4 year internship. We did it in Gandhi Nature College, Hyderabad.
Yeah, that is very convincing
Yes,
concept that more practical knowledge will make you more committed to the principles of nature cure, because it is very difficult to understand
yes, yes.
how a disease gets better without any medicine.
About it.
The entire conventional understanding is every ill has a pill, and
Pill.
here we don't give any pills. Over and above that, we remove whatever pills that they are taking, but still people get better. How this happens? One has to have a close interaction with the patient during the
Yes,
entire
yes.
period. Only then they understand. So that's
That is
how
how
you.
we had a very good confidence when we
Yes.
were interacted with the patients from the beginning. We were not
Yeah.
knowing about much about the anatomy, physiology, healing system, healing how and all. But mentally, we have confidence, gaining the confidence such a way that, oh, seeing that kind of patients equal to 100 times reading in the books. That was
Yes.
got a confident to treat the patient. That strength Dr. Enkatrao Garu was given to us.
Sir, do you remember any peculiar cases that have come during your student days and that got better like a miracle through nature cure? Can you recall?
I will remember one, and I will remember my patient also. I will tell one by one or two, three patients I want to tell you.
Yes.
So once in general ward of Hyderabad hospital, there was a patient. Dr. Enkutra was taking the rounds, and we all students, about 10, 12 students were behind him, and he was saying a patient who was having lot of gastritis and having very chest pain and peculiar chest pain, said, no, no, what is this patient, and oh, who can say what would be your diagnosis? Like that, he was asking us. And all we have seen is blood pressure is normal. pulse rates are normal, and chest is paining like anything. And nobody was, because of the fear or something, nobody is opening his mouth. And I said, there is a chest pain, that too, it is indicating at the left side. Most probably, he may be having a cardiac problem, and he has having a very painful cardiac problem. He got so much angry and came, how did you say this cardiac? Suddenly you are saying that cardiac problem. It cannot be possible. It must be something else. You are wrong diagnosis. No, sir, I must be wrong, but it must be like that, look like that, because chest pain is so high. Then, no. All the chest pains cannot be a cardiac pains. You should understand these things. He is having a history of gastritis, severe gastritis, chronic gastritis, and that gastritis may be having this chest pain. And you cannot say, you give a one enema to him, and now only he will get the relief by this chest pain. We went and given enema, and chest pain is relieved. See, this is a difference between chest pain of those days, and I am comparing chest pain of today's. If this is the answer those days, Dr. Venkatrao has said me tappad marenge tumko aisi. Now, if it is so, definitely there should be a chest pain connected to cardiac regions also. I must be correct on these days, not on that day. See, this is a difference of those days treating the diseases with confident diagnostic without any diagnostic methods, and today's diagnostic with definite diagnostics with modern pathology. And it must be today's is it must be correct. If it would have been today, my question should be a correct one. Those days, yes, it must be wrong. That is a difference. And he got relieved. My answer was wrong that day. Likewise. So, that treatment, very simple modalities. Venkatrao was a very honest, principled naturopath, very principled naturopath. He believed only on the Panchabhutic theory only, nothing else. No drugless healings or nothing else. Panchabhuta is a mean intention. Body is made up of five great elements of nature. Panchamahabhuta, Prithvi, Aap, Tej, Vayu, Akasham. Taking the help and treating the diseases, treating the body by the help of Panchamahabhutas is the disease. That was the only definitions who always used to say to us. Likewise, when I went to the Dharmasthala after the Jindal hospital, can I say my experience?
Yes, sir. Please, please. Yeah.
Those days, even in Dharmasthala, it was not advanced hospital. In the beginning, it has started with a old school building, small school building, with very essential treatments. No modern gadgets, no modern hydrotherapy treatment, no physiotherapy, no electrotherapy. Of course, acupuncture was there, but there was no experienced acupuncturist those days. It has started at the 5th years of experience, 5th years after 5th year of BNYS, then acupuncture people have started coming. We know acupuncture also. So that is simple modalities and simple treatment they were there. I remember one patient those days in 1989, 90, 89, 90, 1990, like that. I still remember her name, Sarala. She was having a lot of skin disease, dermatitis, contact infective dermatitis. She was from Manipal. As you know, the Manipal, there is a big hospital, a very big hospital. She took treatment almost for 3-4 years. Took treatment. Lastly, she has used steroids also for relieving these things. Temporarily used to relieve and come back. Her father has brought to me, and she was about 18, 19 years old girl. Said that this is a problem since 7, 8 years it is going on like that only, taking medicine, suppressing, and not at all curing it all. And we heard by someone and came to you. And what is your opinion about these things? I said you should have to keep her here for at least 2 months with me. 2 months. No, whatever the days you take it, I don't mind. You keep her here and treat well and send her with a normal skin. I said yes. And started giving treatment. And as you said, fasting therapy given for 3, 4 days, and lot of smell, the skin is smelling, oozing the watery and all these things. Those days only gender ward are there in my hospital, male gender ward and female gender ward, no special rooms at all. There were about 8, 10 patients in the female ward, and she was also there, and the smell was coming. Other all 5, 6 patients were, rest of all 5, 6 patients was against and saying that no, we don't want to stay in this hospital because a lot of smell is coming, we may get infected. It is true also. uh, no, no, wait for, I will keep a curtain over here, don't worry. 2, 3 days you see here, and it will be nice, it will be relieved, and the smell also will come down. And afterwards, you don't worry about these things. I'm very confident she will be all right. And they were not at all hearing. No, no, we want to go. I am losing 5, 6 patients because of one patient. What to do? Then once, twice, thrice convinced, all 5, 6 people are kept in mind that want to go. Then I said, you please all 5, 6 people go away. I am very interested of this kind chronic patients having lot of diseases, lot of years that she has suffered here, and I want my interest is to treat her, not to you all people. We can go away, don't worry. Then they made a mind. Oh, doctor is so confident about this patient. Let me stay. Then they stayed it. You believe me or not, about within 1 or 2 days, the smell has come down, and the oozing also has come down. Fasting therapy is so fantastic result it has given to her. And of course, I was not given steam bath to her. For your information, I have not given steam bath. Fasting therapy with Epsom salt bath without any oil applications, so that it relieves the cleansing process of the skin. That much only. And heat bath. Enema, woman, that is a must for her. 2 or 3 days that she got. I said, see, this is the result. Then I removed the curtain and kept her there for 2 months, so that, of course, it was a little bit come and go, come and go, come and go for a month. Then next month it has completely relieved. And father was not intention to make a marriage. Now she's married and she's happily stay there. She always say that you take my name, sir. Tell to the public, so that let the all people say. That's why that is the reason I am telling Sarala. Otherwise, I was not to tell. She has said me this way. So nicely I have treated. This is remembering in my mind all the while, all the time to me. Likewise, very chronic cases, there was no bar at all those days. This patient should not take, and that patient should not take. This is obstructions for the nature. You don't take them. Nothing more. It was completely independent to us to treat any kind of diseases. That is how Venkatrao has given a hint to us. There was a lot many patients, even incurable diseases also has been admitted. In my tenure of beginning 10, 15 years, that many incurable diseases. Say anything you can say. There was a hernia case, Mr. Mr. B.P. Khava, 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 umbilicus hernia. It was to go for surgery. The surgery was not so strange those days. I made a one, what is that? Suparika, uh, adike, supari. That you made it to tie to the umbilicus, betel nut, these things, and tie it over there. Let it be for 3 times a day, 1 hour. Did it 3 months, and that umbilicus hernia has completely gone with abdominal exercise, tying the abdominal pack with that battle nut. These things put in a battle nut on the umbilicus area. That is how. So otherwise, it was to go for surgery, and there was no hernia built also those days. I am very proud nowadays. I said this battle, beetle nut, these things, the umbilicus hernia belt has come up in this way that it has to press to umbilicus area. I am very proud. Oh, those days umbilicus hernia belt was not there. I did it this umbilicus hernia with the beetle nut put there and abdomen back, and it has made it so nice. Maybe the umbilicus hernia belt has come up a later part, knowing about these results only. I felt it in that. I don't know, may not be, I may not be true also. That is how umbilicus hernia without the surgery, it has been treated and cured those days. That is how there are many such cases have been treated in my hospital and named in whole South Canara, Mangalore district and Karwar districts. Oh, that is the only hospital that is chronic diseases hospital. That is a named after that thing those days. So that is how my hospital has come up without any bar of taking a patient. This is not to take. This is not to take. This should be taken. It's not that way. We have taken all the cases without any restriction to public. So any patient comes, yes, I will treat. That was my intention those days. Nowadays there are restriction. Even there also there is a restriction. Everywhere there is a restriction. But my period, my genuine period, I have taken all the cases to my experiences.
Yeah, that is quite a revealing experience of yours.
Mm.
Once you have imbibed the principles, the essence of nature cure, how it operates as a therapeutic tool, using local, natural resources. Like
Yes.
you are saying, using betel nut to push umbilicus
Yeah, people.
hernia by tying it around the umbilicus region is
Yes.
a quite a novel, therapeutic tool, and
Oh, yes.
nowhere in any of the texts it is mentioned. But then you could apply your mind and then come up with a therapy using local, because arak nut is easily available in the area ujre.
Yeah, yeah, correct. Mhm.
Yes, and so using that, you could offer a treatment. That is quite amazing, and we would like to know more such therapies. Now, I thought for the first time I am hearing this, and there is this kind of an amalgamation of natural things and applied to give relief to patient. Yeah, very nice, sir. You have touched upon many aspects of nature cure system in academics and clinical practice, and then public awareness related matters. And so nicely from your experience, you could, discuss about how to go about them. Since we are the people of, improving public health,
Yeah,
and public health comes from two ways. One is doing something positively, and also getting rid of negative things. This
yeah, of
getting
course.
rid of negative things, whoever is doing, I think we should also network and collaborate with such people like this Jodige Swami, and we should also work together with such people to strengthen our field. Yeah. Thank you very much, sir, for your time. And we have learned so many things from your experience. And if there is anything, if you think we need to have one more session, we can have one more session. Please let us know. Thank you
Thank
very
you.
much.